Hi everyone, it's Nigel Giam, the lead GP training program director for St Mary's and also course organizer for Mentor, Med Education and Mentor MRCGP. I'm really happy to have Deeps join us today, who has just successfully passed the recent sitting of the SCA. Hi Deeps, really good to see you. Congratulations.
Hi, thank you very much.
Oh, and as you can see, she's already celebrating with that lovely background there. No sort of black clouds hanging over you anymore.
Yeah.
So obviously you and I go back some way, just with regards to the SCA preparation, but do tell the audience a little bit about yourself, your background, and how you ended up in general practice training.
I'm Deepmala. I've been in like an ancient training. I should say I started my training back in 2019. Then I went less than full time. So I did my SCA. That's my second time, and I've passed. All thanks to you.
Oh, thank you.
I did my first attempt in June last year, and I think I took it a bit too early, really. I just came back from maternity and I was so scripted. I had
Mm,
no idea what I was doing.
yeah.
I did the exam like a month and a half after coming back from maternity.
Mm,
And when I got the results, I remember I was so gutted because I failed by quite close marks. And then I messaged you at 10 o'clock at night asking you, desperate, asking for help. And then I did ask for advice because my nan just passed at that time, and you've messaged and you said you're very happy to help. Then I've attended the flagship course in September,
yeah.
and I am also neurodiverse, so I'm dyslexic and I'm highly autistic. So for me, everything should be black and white.
Yes. Yeah.
And attending that course was quite a big eye opener.
Yeah.
And learning how to give feedback
Yeah.
and all the mantras that are there. I never knew, like, you made it so easy,
Oh, thank
like really, really easy. And all the feedback that I had, it was so helpful.
Oh, that's so kind of you, and I think it's really interesting, isn't it? Because we see a lot of, I suppose, candidates with neurodiversity have issues with this exam, which is quite grey actually at times, isn't it? And I think when you're kind of seeing things as black and white, it can be quite difficult when you're faced with, presentations which are quite nebulous or things that don't fit boxes. Cases that you can't really necessarily learn from a book. So it would be really interesting, I think, for the audience to listen to your game changers maybe for each of the three domains. So maybe we can start with data gathering. What do you think the main game changes were for this reset for you?
So I learned the three mantras, and I think every case that we get, the 3 minutes is really, really very important. That every information that you're given, it is important. It's not just given just for the sake
That's right.
of it, really.
Yeah.
And if we do know all, on what the domains that you are being tested on, if during that 3 minutes, if you go in there with a very open mind, but just be mindful, like everything, starting from the sex, the
Yeah.
age
Yeah. Yeah.
of the patient, everything is very important. Even
Yeah.
the address is very
Yeah.
important,
Yeah.
because sometimes you just don't really think.
Yeah.
Like in my case, I mean, in the exam that I did, I'd had an address of a very weird place, and then that patient was homeless.
Yeah.
So every information that you're given is really important.
Absolutely.
And in data gathering, it's really important that, right in the beginning, the opening statement tells you where you'll be going.
Yeah.
Is it like something quite medical, or is
Yeah.
it a negotiating station?
That's right. That's
And
right.
opening ice really early is really, really very
Yeah.
important.
Yeah.
Really important.
Yeah. Yeah. I agree because actually, I suppose the things that work in your favor is that all the patients will have ice built into their
Yeah.
narrative. And actually, if you open that early and in context, it shows the direction of travel.
Yeah.
And actually, as you say, the opening statement often alludes to maybe even a component of ice. I'm worried about this, or I would like this from you. So then it's just about being curious around that and, opening up the other components of
Yeah.
ice. The way we teach it now on the course is actually as LISIF, which is to really understand the impact it's having on one's life and how it makes them feel. So
Yeah.
for your homeless patient, for whatever he needed, just the impact on his situation, being homeless and how that's actually making him feel in that situation. So that's really, really important. What about the clinical management? What were your game changers there, do you think?
I think, many of us do think that though the clinical management weigh the highest, we have to, it is, many of us, even me, from my first experience, I thought I should, it is very, like about all the medicine, but
Mhm.
it's not.
No, it's not.
So if you don't know the ice, you haven't reintroduced the ice in the management, haven't used it properly, and you haven't explored the psychosocial part, you haven't brought that into your management, then you will definitely fail. So in the data gathering, it is always like ice, and also be present,
Yeah,
in the moment, listening to that patient, whatever they are saying, and
yeah,
whatever they and some of the actors are very helpful.
yeah.
If they can see, like I had out of 12, 10 stations were just about negotiating. You,
Wow.
you tell them something and they would just tell you no, they can't do it. So
Yeah,
how to think outside the box. And
yeah.
if you haven't asked about the psychosocial, you can't really do any of the management.
That's right. That's right. And actually, as you say, the simulators are there to help. They'll help in part because if they're saying that's not possible and that door's closed, it's not going to open. So there's no
No.
point in forcing that. And you do have to negotiate. And we use this word, and this word will be ingrained now, won't it? Is the word dilemma to
Yeah,
showcase
we have to.
negotiate.
I've used it. You will never believe me. I haven't even think about my husband so much that I was thinking about you for that exam.
Oh
Like,
dear. I don't know if your husband will be very happy to hear
I
that. You're
was
just thinking
I
about
was
me.
I was just thinking about, about all the mantras and what
Yeah.
I did before, after you get, I mean, for those people who are going for the first time. So
Yeah.
basically after they would do all the checks, you will wait for about, after the check is when your exam starts. So basically sometimes you can get 30 minutes or 45 minutes before you can start, the station will
Yeah.
start.
That's right.
And
That's
during that time, what I did, I brought a very big whiteboard,
straightforward. Yeah.
and on that whiteboard, half of it, I wrote all the mantras down there,
Yeah.
so I don't forget.
Yeah.
That was and that was written in permanent marker, so it doesn't get
Mm.
wiped off.
Mhm.
The other half, I did write about the data gathering,
Yeah.
what I need to ask, like what I
Yes.
wouldn't miss,
Yes.
and the clinical management, of course, just to
Yeah.
redress eyes,
Yeah.
and and what I should just jot down so I don't forget.
Yeah.
So
Yeah.
I was thinking about you all the time, all the
Oh,
mantras, like 10, just imagine 10 out of 12 was just about negotiating,
that's so
negotiating.
heavy. I mean, we know that negotiation features heavily, but that sounds like it was a very heavy sitting of negotiation. So that's great. And I suppose just for the audience, because some of the audience won't know about the mental mantras, it might be worth me just explaining that. But the mantras that I was teaching Deeps are around narratives. So story, symptom, system. The story is Deep saying, starting off in the patient's notes. So understanding where we are in their journey, opening up LISIF so we understand the direction of travel, and using ICE to then focus down on the presenting symptom and the red flags of the system that we're interested in. So everything is centered on the patient's agenda. And then as we move into the second half, as Deep says, we have to actually readdress the patient's ICE. We have to manage the situation as opposed to just the symptom and the patient before the diagnosis. And ultimately, we've got to make a commitment to risk and manage uncertainty with confidence. So that's our main mantra: story, symptom, system. We also teach a mantra around negotiation where this word dilemma really features very heavily because it is a huge buzzword, isn't it?
Yeah, yeah, it is. It
Yeah.
is.
And then really our final mantra is for follow-ups. Again, just understanding what was discussed with the previous GP, but making sure we deliver the results very early on so that we can get into the crux of the case quite quickly before we go back into necessarily the narrative or questions that we want to ask. And I suppose that takes us on now finally on to relating to others, because we know you're a really, really nice person, but actually it's not just enough to be nice, is it, in this
No,
exam as well?
no. So IPS is not only, many people do think like just being nice is what you're being tested on, but no, but because if it is something that the patient is asking and you think just being nice and you give that to that patient, you fail
Phil?
basically.
Yeah.
So for IPS, I think not missing up the cues is very important. Yes, being nice, but if you feel like this is not something that you should be giving to that patient,
Yeah.
you still saying no, but then you have to know what you're giving back in return. That's really
Exactly.
important.
Yeah.
And also this exam is not a ticking box, like you said, it's not a ticking box at all. So it is a narrative. I had one station whereby I just got into a real blank. It was a Graves' disease station, and I just couldn't. At that point, I couldn't. I just couldn't think about the diagnosis.
Yeah.
So many people, many of us, do think that you need to know a diagnosis to pass.
Mm.
Not,
Okay.
and you just can't miss any cues. That's very important. And also, um with many people that have practiced, many people do tend to say, I'm sorry,
Yeah.
but whatever when you're saying sorry, you have to mean it really. And
Exactly.
also to acknowledge, and the AEE part is so
So
important.
important, isn't it? So just for the audience, what AEE is really firstly acknowledging the emotion that's panning out in front of you, because you can't really empathize with emotion unless you actually understand where it's stemming from. So mirroring, saying what you see, meaning what you say before you empathize with the patient's situation. And then the finally is about energy, about what you can do to help. And I
Yeah,
think, you know, the reason we do these videos is because there's so much you can do to help in the SCA. I mean, you know, we've had so many lovely success stories like yourself, but you know, I think for the audience, it's an attainable exam if you have the right strategy. It's very
yeah,
attainable.
yeah,
Um,
definitely,
I mean, what would
definitely.
you be saying just as your kind of last messages? Because I
I
suppose
think,
there's a
yeah,
lot of people out there who will unfortunately have failed the exam first time, second time,
yeah.
third time. There's going to be a lot of people extending and taking it in the autumn. How do we get them? How do we get their energies up?
I think you have to sit down and think what you've done, wrongly the last time.
Mm.
And if you can afford, definitely do the course. There are, if you see out, there are so many people who just finished their SCA and they're becoming SCA mentors, and it's
Yeah,
it's
I know. It's a bit,
frightening.
I know. And you know, I'm all for people being passionate about education, but sometimes you need an old dinosaur like me, I suppose,
No, yeah. And
just
like
to show
and
the
like
way.
my son, he's got speech delay, and every time we used to listen to your videos, he would say King Dragon. That was so
That's
funny.
him.
He would come out in the
Oh, bless.
kitchen if I'm cooking, it's like, here we go, King Dragon.
Well, I've been called many things, but I will take that one definitely. I love that one.
Yeah,
Thank you.
so I think it's really important that you invest in the right course if you want to go for a course. And I think the course that you offer, um, you make things so simple. Like, you have changed my life. Like, I am such a better GP now. Like, even
Oh,
like my supervisor said, you're a changed person from when she met me last year in August.
right.
And yeah, it is such a game changer. I think, like, if someone would ask me, what course
Mm,
they should attend, I would say attend your course and start early.
yeah. I think starting early is just so important, isn't it? Oh, bless you, Deeps. That's so lovely of you to say. So now, anyway, CCT's just around the corner. All the
Yeah,
all the tough stuff out of the way. What are the plans post CCT?
I'm not sure. I'm not. I'm not sure. We don't have any jobs any really, so
Oh dear. Oh no.
I
I
don't
know
know.
it's a bit
I
tough.
don't know.
I know.
Yeah.
But look, general practice is a very small world. There's always opportunities, and I always stay in touch with everyone that I've taught. So you know, you and I, we will keep in touch, and I'm sure
Thank
one
you
day
so
we will meet face to face as a
And
zombie.
thank you so much for everything. I mean, I can't express my gratitude. I will never be able to express my gratitude enough. Words are not enough.
You're
Yeah,
very
it's
sweet.
enough. Yeah, but
Oh,
thank you so much.
thank
You
you.
are such a gem to cherish in the
Oh,
training world.
thank you.
Um, yeah, I mean, I feel like everybody should have an opportunity if they can. But he's like, you're a very busy person, as I know. But like, if
I don't
if
know. Maybe AI, I can clone myself in some way, but for the moment, it's just me.
it's
Yeah.
difficult, yeah. But it
Oh,
was so, like, the course was so good. Was
oh,
and it
thank
was
you.
like all the feedback that I had on, I've been looking at all the videos all over again,
Oh, thank
and
you.
I've learned so much. So thank you so, so
Pleasure.
much.
My pleasure. All my pleasure. Deeps, well done. Thank you so much for doing this,
Thank
and it's very inspirational to hear your story. Keep in touch, okay? And stay well.
you.
Take
Take care. Bye.